PMS versus pregnancy symptoms. Symptoms of PMS may mimic those that indicate pregnancy, and this makes it difficult to tell the two apart. When you are trying to conceive, it is extremely vexing to stay patient for the 2-week period between ovulation time and the date your cycle is expected to start, to know whether you are pregnant or not. But, here's the catch. During this waiting period, you may experience certain symptoms which can look identical to PMS. Therefore, women who have never been pregnant before may find it almost impossible to draw a line between the two, PMS and pregnancy. As most doctors would suggest, the only reliable way to determine a pregnancy is by taking a pregnancy test. However, there are some symptoms of PMS which are not typical of pregnancy. In the following sections, we have listed down the common symptoms of PMS and those of pregnancy, after which we have tried to explain the symptoms which can differentiate one from the other. PMS and its symptoms. Premenstrual syndrome, as the name suggests, occurs before a woman's monthly period, usually during the second half of the menstrual cycle. PMS symptoms refer to various physical, emotional, and behavioral changes that take place in the body. Although this condition affects most women at some point in their lives, those in their late 20s and early 40s have a higher tendency of experiencing it. The physical, behavioral, and emotional symptoms which are commonly indicative of PMS include acne, anxiety, fatigue, bloating, leg pain, dizziness, headaches, migraine, joint ache, feeling low, muscle ache, tearfulness, weight gain, low sex drive, swollen breasts, trouble while sleeping, increased anxiety, abnormal aggression, low level of alertness, abdominal discomfort, tenderness in breasts, lower back pain, cramps, changes in sleep pattern, food cravings, sweet, salty, abnormal changes in skin and hair, increased sensitivity to light and noise, discharge from nipples when pressed. It may be noted that PMS is different for every woman. No two women may have exactly the same symptoms. You may experience the same symptoms every month, or slightly different symptoms with varying intensity. Pregnancy and its symptoms. As it is with PMS, pregnancy too is different for different women. Here is a list of the most common symptoms that occur during pregnancy. However, unless confirmed by a doctor, these symptoms may not necessarily indicate the same. Cramps, bloating, melasma, leg pain, mood swings, constipation, missed period, pregnancy acne, nipple discharge, morning sickness, darkening of areola, breast tenderness, shortness of breath, swelling in breasts, headaches, backaches, dizziness or fainting, sore or tingly breasts, frequent urge to urinate, extreme, unexplainable fatigue, elevated basal body temperature, spotting or implantation bleeding. Breasts may start feeling heavier or fuller. Food cravings or aversions to certain foods. Vaginal discharge, white, milky in appearance. Increased sensitivity to non-pleasant and pleasant smells. The difference. Symptoms which may help you tell pregnancy from PMS. 1. Missed period. This may be considered a reliable sign of pregnancy if experienced by women who have regular menstrual cycles. 2. Spotting or implantation bleeding. It occurs when the fertilized egg attaches itself to the linings of the uterus. It usually occurs 6-12 days after fertilization of the egg. Bleeding is shorter, lighter, and blood appears pink or brownish, which is not normal. Also, not all women experience implantation bleeding. 3. Frequent urination. Pregnancy causes the uterus to grow and push against the urinary bladder. This triggers a frequent urge to urinate. 4. Increased sensitivity to smell. Pregnant women may develop extreme aversions not only to certain odors but also to smells, which they may have found pleasant before. 5. Morning sickness. Almost 90% pregnant women experience it. It refers to a feeling of nausea. Although called so, it can occur at any time of the day. 6. Elevated basal body temperature. If this persists for 18 days or more post-ovulation, it is most likely a sign of pregnancy. 7. Shortness of breath. Pregnant women may feel that they are short of breath. This can be explained by the extra need of oxygen for the growing embryo. Experts suggest that if this symptom occurs suddenly, is accompanied by pain, or gets worse when lying down, then it must be reported to a doctor immediately. 8. Darkening of the areola. Elevated estrogen levels in the mother's body increase the size of the areola, which becomes darker as the pregnancy progresses. 9. Melasma. Also known as the mask of pregnancy, melasma is darkening of skin areas that are mostly exposed to the sun. It resolves once the pregnancy ends. When in black and white, it may be simpler to infer the difference between PMS and pregnancy symptoms. But, it is all the more difficult when it comes to the real thing. For instance, many cases occur wherein a missed period comes out as a false alarm of pregnancy. The same goes with darkening of areola, and so on. Eventually, a pregnancy test is the best way to determine whether your symptoms indicate pregnancy, or they are just another bout of PMS. Take care.